Okay, so we are in the med room to do Marchex 1 and 2 for Casey Banks. We're going to give ibuprofen and Alternagel today, so I have to grab those from the med system. So first I'm going to do my hand hygiene here. So I have Casey Banks, date of birth 10/2/1965, allergy to aspirin. Today we're going to give ibuprofen, and I have ibuprofen here and ibuprofen. Oral route, I have 1 oral tablet and 1 oral tablet here. BID, dose of 400 milligrams. I have 200 milligrams, 200 milligrams for a total dose of 400. Do it 0900. It was not given today. This expires July 2023, and this expires July 2023 as well. And ibuprofen does not contain aspirin in it. So that's Marchex 1 for ibuprofen. I'm going to move to Marchex 1 for our Alternagel. So we have Casey Banks, 10/2/1965, allergy to aspirin. We have an order for Alternagel, aluminum hydroxide, and I have Alternagel aluminum hydroxide here. We have 600 milligrams per 5 ml concentration, 600 milligrams per 5 ml concentration here, oral suspension. We're giving 15 mLs PO by mouth. This is an oral liquid, and there is enough in here for me to pour that off into a med cup. This is every 4 hours as needed for indigestion. Our patient does have indigestion, and it was not given recently in the last 4 hours. This expires December 2024, and this does not contain aspirin in it. So we can see that here in the ingredients. So Marchex 1 is complete for that. I'm going to move to Marchex 2, but first I'm going to pour my medication. So I'm giving 15 milliliters. What I'm going to do is I'm going to pour this at eye level into a plastic cup after I shake it. This always has to get shaken before we pour it into a med cup for our patients. Oops. So I'm going to palm the label here, and I'm going to pour 15 mLs into my med cup. Okay, I'm going to wipe that off. You can use a paper towel for this. Cover that back up. And I have 15 mLs, 15 mLs. So now I can move to my Marchex 2. So I'll start with my ibuprofen, stay in order like we did before. So again, from the top, I have Casey Banks, 10/2/1965, allergy to aspirin. Today we have an order for ibuprofen, and I have ibuprofen here and ibuprofen. These are for oral route, and I have an oral tablet and an oral tablet BID. Dose of 400 milligrams. I have 200 milligrams and 200 milligrams to give me 400 milligrams. Do it 0900. It has not been given for that due time today, and we already checked our expiration date and allergies. So Marchex 2 is complete. I'm just going to put these aside in a cup, and now I'm going to do my Marchex 2 for my Alternagel. So I'll flip this over. I have Casey Banks, date of birth 10/2/1965, allergy to aspirin. We're giving Alternagel aluminum hydroxide, and I have Alternagel aluminum hydroxide here. Our concentration that's ordered is 600 milligrams per 5 ml, and I have 600 milligrams per 5 mLs oral suspension. We are going to be giving 15 mLs by mouth, PO, and I'm going to verify that I have 15 mLs here. Which I do. Okay, so verifying that what is poured is correct. Every 4 hours as needed for indigestion. It has not been given today within the last 4 hours. And again, we already verified our allergies and our expiration date of this medication. So I'm now going to put this in a tray and head into our patient's room.